This is Dr. A.J. Shah. I'm sitting down with Mr. Ledesma, Ricardo Ledesma, and I want to specifically talk to Mr. Ledesma about the cost of medications and see what he's trying to do to hopefully get off many of his medicines. As a matter of fact, start feeling good and living a good, healthy lifestyle. So tell me, last time you were here, we were able to stop your Divan, right?
Correct.
And Divan is a medicine for high blood pressure, and it costs about probably I would say $60 to $70 a month. Unfortunately, it's not a generic medicine, so you cannot replace with generic. So, but with his exercise, stall control, weight loss, we were able to stop his Divan. So he already has started saving $60 a month. That's a great achievement for him. And today his blood pressure is 114/68. I mean, isn't it a great blood pressure?
It really is. I mean,
tell me, how did you do this over the last 6 weeks? You lost about how many pounds?
probably about 15 pounds.
And how did you do it?
Exercise and stay off the salt and do exactly as you told me to do.
Yeah. And you started with exercising 20 minutes. How far you are now?
I'm doing 40 minutes a day now.
And what type of exercise is the 40 minutes?
I'm doing treadmill right now,
Okay.
just a treadmill, and I'm going to go ahead and try to get on, go to a spa and start working out over there.
Yes, because what I want you to do, out of that 40 minutes, I don't want you to do more than 15 to 20 minutes on treadmill, max.
Okay.
And that's also every other day.
Okay.
So when you go there, go every day, but use bike or elliptical or walking in the water or light weights or weight training for your quads.
Okay.
But do only treadmill every other day, no more than 20 minutes.
Okay.
So that way your knees and hips are protected.
All right.
Because we don't want to, have the hurt and then have a major issue. So what you've done is great, but I think now mix all different type of exercise so your knees and hips are not damaged. Now, what other medications you're on? Let me look at the list here. I have the list right here.
Ask me to remember all these.
Let's see. We have a list right here. So you are on this medicine called Lovaza.
Right.
Lovaza is a medicine which is essentially a very high dose omega-3, and that lowers the triglycerides, and that costs about $90 a month. And then he is on Niaspan, which also helps to lower the triglycerides, and that's about $80–90 a month. And then he is on Vytorin, which also lowers the triglycerides and cholesterol, and that's about $80–90 a month. So we're talking about $270 to lower your cholesterol. And the way you're doing it, I wouldn't be surprised. Gradually you get off a lot of these medications.
Good. I can't wait.
Possibly go into generics, and then it would be $10 a month.
Right.
That to me would be an ultimate way of winning this economic concern. Otherwise, you work hard, you earn money, and half of your money goes into the medications and seeing doctors and going to the hospital. That just doesn't make sense.
Right.
But if you put a little bit of money in yourself, a little bit of effort in yourself, joining a health club, going to the spa, eating right food, buying right type of food, you can get off a lot of this medicine. Now you already are off the Divan, which is about $80.
Right.
And I think many patients don't realize that this is all doable. The way I say it is that if God gives you disease, God gives you cure.
Right.
It's in your hand. It's not in doctor's hand, it's in your hand.
Right.
And you are on this Nexium too, You know how much Nexium costs? Nexium is $150 a month. And why do you take Nexium? For reflux, right?
Correct.
As you lose weight, reflux gets better and better.
I hope that's the case, yeah.
Because people who are overweight, the ligament which holds the esophagus tight together,
right,
that muscle which holds it tight together, get a lot of fat infiltration there. So the muscle doesn't contract properly, and that leads to the leak from the stomach to the esophagus.
Oh, okay.
But as you clear out the fat from the ligament and muscle, actually start contracting better. And people say, but why did my reflux get better when I lost weight? Just because the fat has gone away from the muscle area, so muscle has now a chance to contract properly.
Oh, okay.
So as you lose weight, you're going to get another $150 off.
That'll work.
So as you lose weight, as you need more clothes, you're going to get more clothes because these medicines are going to go off. Okay. That's a great news.
Sounds
Anything else you think we are doing or we need to do?
No, I think that's about it.
Do you know CPR?
I do.
Well, how did you learn CPR?
I used to work for special transportation, and we were required to go ahead and learn this Yeah, part of our job.
And when was the last time you did the
Oh,
CPR?
it was quite a while ago. It was probably about 15 years ago.
So you think it's time to recertify in CPR?
Sure.
Because I think technique has changed. The compressions are the most important thing.
Right.
You know, when I was in medical school and when you did it, the compressions are important, but we were giving a lot more breaths, and we realized it's a compression which is going to save the life. Breaths are important. Breathing part is important, but it's the compression which is the most important.
Right.
So we'll get you back in training again at our office, get you trained, so you can help somebody, so somebody can help you.
Good deal.
Good. Thanks. Yeah.
Thank you.